Hi, girls. Palliative care is a science and it is a medical approach which has been devised to give care to the patients who are terminally ill. Terminally ill patients means they have no more chance of living further. So, such patients are called as the terminally ill patients. In palliative care, the science focuses on mitigating the problems of such patients. The problems can be physical, mental, psychological, or it can also be emotional and social. So, comprehensive care given to such terminally ill patients is called as palliative care. Here, these patients are given care by a team of medical fraternity, and also they focus more on mitigating the symptoms of such patients. Let us now see about certain aspects of palliative care. As we understand, whenever there is a problem, a pain, a disease, or an infection, along with the disease or infection, we also experience psychological distress. Even when we have a slight headache or when we have a stomach ache, we don't act normally, and there are various kind of psychological experiences associated with a small pain. But when there is a patient suffering from a chronic disease, and if he or she is terminally ill, then there are a lot of problems. Apart from the physical problems, there are plenty of psychological problems associated with the disease, particularly when they are terminally ill, when they know that there is no possibility of extending their life. There are plenty of psychological problems associated with that. In this unit, we will be seeing the psychological problems or the psychological distress experienced by the terminally ill patients. So, what is a psychological distress? Some psychological distress will occur with any life limiting illness, which means the patient is going to die in the near future. And the ability to recognize and relieve this is an essential skill in palliative care. So, when a patient is psychologically distressed, he will not show any improvement, even if there is a medical care, medical attention given to the patient. If the patient is psychologically distressed, then he will not show improvement even for the treatment. Therefore, the focus in the medical team should also be given to the psychological aspects. Now, even now in this corona period, there are counselors, there are psychologists who are giving advice, who are giving counseling to the patients who are experiencing this illness. There is definitely cure. All of the patients are not going to die. If the patients have to respond to the medical treatment for which he should be mentally strong. So, the patient who is terminally ill should be given different types of counseling. People should talk to them. There should be somebody who is taking care of them. And in that way, the psychological distress of the patient can be relieved to a great extent. And this has to be given of utmost importance. What are the factors that can cause psychological distress? First and the foremost is the disease itself. It can be a renal disease, it can be a cancer, or it can be any type of malignancy. So that particular disease itself will cause distress to the patient. And if the disease is rapidly progressive, right? So if the cancer is going to go from level grade 1 to grade 2 and then to grade 3, the disease progresses. Same is the case in any type of chronic disease. If the disease progresses, if they're going to feel bad day by day, then, and the clinical features changing frequently. So today they may have some kind of symptoms, tomorrow they will have some other symptoms. Say for example, today they are experiencing nausea, and tomorrow if they are going to start vomiting, so that is a progressive in the symptom. The clinical features definitely will change, and this can cause psychological distress in the patient. They may feel, yesterday I was better and today I'm feeling more sick. Present and anticipated disabilities. So what are all the disabilities now? And what would happen in their future, anticipating their disability. Today they are able to walk, but still the walk is not steady. But tomorrow they may have a fear whether they may be able to walk or they will become bedridden. Disfigurement. When there are changes in their body, the color change, the change in the weight, the change in the appearance, the change in the look, and dependency. So when a patient is terminally ill, chronic disease, when they've experienced the disease for a very long term, maybe for years, they have to depend upon somebody. They are not able to do their own work. That itself can cause plenty of psychological distress. Physical dependence. If they have to sit up, walk, if they have to depend on somebody, that is irritating, is it not? We had all the time been walking by ourselves. And now, if somebody has to support us just to sit down or walk, itself will cause plenty of distress in the patient. Protracted illness with physical and psychological exhaustion. So the illness progresses and they become physically weak and also psychologically weak as the disease progresses. And the next factor is the patient himself or herself. So that is an important factor that leads to psychological distress. The patient does not fully understand the disease and the treatment what lies ahead. They have to know about the disease, the nature of the disease, the pathology of the disease, and what actually happens. Even in a small disorder, like, say, for example, if a patient has diabetes mellitus, and one fine day when the blood sugar shoots up above 300 maybe, and they faint, when they're taken for examination to the physician performs a series of tests, and he or she says that the patient has diabetes, and therefore from the next day onwards they should not be consuming all the simple sugars including sweets and the sugar they add to coffee or tea. The immediate reaction in the patient would be that they would say, I will not get this disease, right? So this will be the statement that most of the patients say. I will not get that disease. I just had a giddiness. I fainted just because I had overworked or I did not eat properly. So they don't understand. They don't accept that that particular disease has been in the person. And the treatment, they don't also understand what is the treatment, what is the protocol of the treatment, and what they have to follow on a day-to-day basis. So they have to understand what the treatment is and how the treatment has to be systematically followed. Many of them, when they go for treatment to a doctor, for the first few days, maybe weeks, they will follow the instructions of the physician, and then later on they forget. Once their body responds to the treatment, and once they start feeling better, they stop the treatment, and on and off they'll be using the treatment sometimes. So these are all the problems with the patient, and it is made worse when no simple explanations are given. So many a time when we go to the doctor, when we visit the doctor, and the doctor we will be telling the signs and symptoms. There is a headache or there is a stomach ache. So the doctor listens and he just gives the prescription, and we come out with a note of prescription. The doctor might not have explained what actually has caused this problem in the individual. So, when the doctor may not find time, or he may think that we may not understand what he says, or he may think that he should not frighten the patient. So, due to any of these, the actual explanation of the particular disease and the symptom associated with this may not be given, and this can make the things even worse. Next is the fear of pain, or the fear of dying, or the fear of disfigurement can cause psychological distress in the patient, right? So when a patient, say for example, has cancer, they know, all of us know that it is associated with pain, and the pain is really very severe, and some of the cancers are definitely treatable. It depends again upon the grade of the cancer. But once a person is diagnosed with cancer, the immediate thing that arises in the patient's mind is the fear of dying and also disfigurement, right? There are different therapies that are available for cancer treatment, and it of course leads to disfigurement, right? There may be hair fall, and there may be changes in the skin, and all these may cause fear in the patient. And the loss of control, independence and dignity, right? Loss of control. What is loss of control? Loss of control on what is oneself and also the family members, right? So they lose control to a certain extent. They may not be available in the family all the time to take care of all the things that are taking place in the family on a day-to-day basis, or they may be or they have to be dependent upon somebody for their day-to-day activities. And dignity, they think that there is also loss of dignity. When we say that a patient is COVID positive, many of them do not say, right? They do not say that they are COVID positive because they think that it is a loss of dignity. And I don't think there is anything associated with dignity and the disease. Helplessness, right? So the disease has come into the patient is infected, the patient has a degenerative disease. So how can they control that? They feel that they are helpless, and there is hopelessness. They do not know what will happen to the future, and there is hopelessness and dependency. Insight regarding poor prognosis, right? They have to understand when a particular disease is treated, when the patient takes proper medical treatment, they do go to the better stage. They should understand that they are improving. When they don't understand that there is a prognosis in the disease, this itself can cause plenty of psychological distress. And if the patient himself is a anxious personality, right? Anxious personality is one who thinks that everything has to happen immediately. So, particularly in treatment of diseases, in chronic diseases, nothing will happen immediately. So, anxious personality, if he is, and if he has any pre-existing personality traits, if a person has bad temperament, if he is a moody person, or if he already has certain psychological problems, then all these will aggravate because of the terminally ill condition. Pain and doubts whether suffering can be relieved. So many of them will have doubts. So if I take this medicine or if I take this injection, will I not have the pain? They may have the doubts such as these. Lack of confidence in medical and nursing attendants. First of all, they have to trust the doctor and also the team that gives them the medical care. If they don't trust the doctor, if they don't have confidence in the doctor, they are not going to feel confident in the treatment as well. And unrelieved pain. So the pain, they should think like it should disappear like a magic. Nothing will happen like a magic, right? Everything has to go down step by step, right? If magical events and magical things cannot happen in the medical treatment, and if the pain still exists, if they're not relieved of the pain, this also leads to psychological distress, because the mindset of the patient will be, I've been taking medicine for the past 1 week, and I feel that only when the medicine is taken, there is no pain, and after I stop the medicine, there is pain. So when there is a cancer growing inside, when there is a tumor inside the patient, and will that disappear when we take medicines for 1 or 2 days? No, it is not going to take place. So they don't understand that. And this itself can cause psychological distress in the patient. And the symptoms. If the symptoms are uncontrolled or poorly controlled, it leads to psychological distress. The pain or the different types of symptoms that are associated with the disease. If they, for example, if they have a breathing difficulty, say for example, so it has to be taken care of. If they are going to feel dyspnea all the time during that day, then the patient, of course, will lose hope in the treatment, and it will cause plenty of distress in the patient, because when they are not able to breathe, then they can think of nothing except that. Perceived lack of interest in medical attendance, right? So we judge, they are judgmental, and they say that one is not taking care, the nurse is not taking care, the attendant is very rude, right? All these things, and unaware of the cause of different symptoms. So there may be series of symptoms, lot of symptoms associated with the disease. When they are not aware that such symptoms comes along with the disease, then there is a problem in the patient. Treatment. When there are diagnostic delays and multiple failed treatments. Diagnostic delays, a urine test can be done or a blood test can be done. Certain blood tests can be, the result of certain blood test we will receive immediately, some after a few hours, some require even weeks. Say for example, a culture test is done, it will take a couple of days for the results to come back to us. So they should understand that certain procedures, certain diagnosis require certain period or time. So if they don't understand that, and they say even the test results are not, they're not giving me the test results appropriately, this leads to psychological distress. And the multiple failed treatments. Sometimes treatments also fail. All the individuals are not similar. There are individual variation. A treatment that best fits to one patient may not fit to another patient. And if the treatment fails, they lose hope, and it leads to psychological distress. And the side effects of therapy. There are various side effects of different types of therapy, right? So the medication given for one disease can affect some other. It can affect the nervous system, it can affect some other system in the body, and this also leads to psychological distress in the patient. And the treatment team. The treatment team comprises of the doctor, the nurse, the biochemist, the pharmacist, right? All the people who take care of the patient, they are the medical team. When there is poor communication between the medical team, again, there will be plenty of psychological distress. The doctor may not directly tell about the disease and the consequences of the disease to the patient, because the patient may feel scared, and the details may be shared with the spouse of the patient or the son or daughter of the patient. In that circumstance, the patient may feel that he is not told all the details about the disease, and this itself can cause plenty of psychological distress. Or with any team member, if say for example a sample is taken, a blood sample is taken by the biochemist, and the biochemist necessarily does not explain the patient for what the blood sample is taken. They come and just they take the sample of the blood, and these things may irritate the patient, and they may feel that things are not told directly to the patient, and this is called as poor communication and lack of continuity of care. So the care that is given to the patient should be continuous, right? If say for a certain period of time they are admitted in the hospital, a proper care is given, and once they come home, if that care is not experienced by the patient, then that also can cause distress in the patient and exclusion of the family or the carers, right? When they feel that they are excluded from the family, when they are no more part of the family, or the patient or the person who gives care to the family. So all these can contribute to psychological distress in the patient. The social factors also affect the patient, causing plenty of distress. Loss of job is the first thing. If it is an employed person, be it a man or a woman, and when they have to undertake medical treatment for prolonged period of time, they may have the fear of their loss of job. And because of loss of job, the next consequence will be the social position, right? So they may not feel that they are more powerful like they were earlier. So they may think that there is loss of position in the society and also their role in the family. So till yesterday he was the head of the family, and now because he is having a terminal illness, he may not feel powerful. It is not that he is not powerful, he is powerful, but the psychological feeling is he may think that the other people are taking over the powers of the family and he is no more powerful. He feels isolated, right? So he feels that he is alone, he's isolated. This can be sometimes real, he may be isolated, but sometimes he thinks that he is isolated. People are not taking care of him and he is just left alone and he feels lonely, feels a burden on family and carers. So he will think that he is going to become a burden for the family members and for the person who is going to give care for him or her. Unfinished businesses. So this will be the first thing that will occur in their mind. So he has to complete certain duties, responsibilities for the family. It may be a personal responsibility or it can be a interpersonal, maybe for his wife or for his children, or it can be a financial constraint. So he may think he should have done certain things. So all these unfinished tasks also will worry the patient. Financial hardship. If he is not going to go to the job for a very long time, then he is going to experience financial problem also. He will not be getting the salary, or if he is a businessman or a businesswoman, he is not able to hold the business. He's not going to he'll not be able to run the business properly, and there may be loss, and it can lead to financial hardship and fears of the family. Then he may think, what will happen to my wife, or what will happen to my husband, my children? And all these can cause distress to the patient. Cultural factors. Cultural differences in attitude to the sickness, suffering, loss, and death. It depends upon the culture. A person who is living in a, say, for example, in a cosmopolitan city, when he is told that he is having diabetes, he may think that everything has come to an end. His life will furthermore become a failure. But the same thing when it happens in a village, and the person has a little bit of awareness on diabetes, he's not going to respond in the same way. So the cultural differences can also cause distress, and the language barriers. For example, a patient who is living in Tamil Nadu go to some other state for a particular type of treatment, or if a person who is living in Africa comes to Chennai for treatment, and what happens to the language? What the patient talks, the doctor is not able to understand, and what the doctor talks, the patient is not able to understand. The language barrier can also cause distress. Spiritual, religious issues. So when a person experiences a life-threatening illness, the first attack will be on the God. So I've done so many things for you. I had done pujas daily. I had done that. I had done this. Why should I get this disease? Why did you give me such a punishment? Will be the reflection of the patient. So the religious issues, spiritual issues, example, remorse. Remorse is being detached. There may be guilt. Guilt is, I have not done this, or I have done such and such things. So that is why I have got the punishment like this. And unfulfilled expectations, meaningless sense of life, and suffering having no meaning. What are the clinical features of psychological distress? Psychological distress is often described in terms of anxiety or depression, but most patients suffer a range of other emotional problems. They do not necessarily or commonly reflect psychopathology, and some, like denial, are best regarded as the clinical manifestations of coping mechanism. Agitation, restlessness, and mood swings are particularly common. These are some of the psychological distress experienced by persons who are terminally ill. Anxiety, depression, anger, frustration. Frustration is they don't get the things that they think they will get. Irritability, hopelessness, despair, helplessness, regression, denial, guilt, a feeling of guilt, fear, grief, passivity, avoidance, sadness, misery, remorse, withdrawal, apathy, inappropriate compensation. Sometimes they will like to show to others that they are really not worried about the disease, and they will try to be happy, they will try to be joyful, and lack of cooperation with the carers and unresponsive pain. The next aspect is denial. Denial is the most frequently seen coping mechanism. Non acceptance is denial. Does not necessarily indicate the patient has not had everything explained. It is necessarily abnormal or pathological. This type of denial behavior in the patient is abnormal or pathological. It is so common that it could be regarded as a normal feature of life threatening illness, right? It comes along with the illness. So the illness, the disease itself is a package. So along with that package, along with the disease, we get other things also, psychological problems and the other problems. It allows patients time to come to terms with their situation. So acceptance is very important, and it does not come in a day or two. It takes time. An alternative description is suppression of information, which emphasizes its protective function. Should not prompt team members to force information on the patient, but alert them to a defense mechanism. So, when a person is diagnosed with cancer, it is not necessary that it should be told to the patient immediately, right? So it could be told to the family members, and the patient can be told, right, they have some problem, but it can really be treated, and the patient will be cured in a couple of days, or it may take a week or so, right? So you do not immediately force the information on the patient. It is often cited by relatives as evidence that the patient does not know, does not want to know, and that information should not be forced on them. So the relatives, the caretakers, the family members themselves say that the patient does not know that he is experiencing such a very bad disease, or sometimes the patient does not want to know. The patient knows that he has some problem, but he does not actually want to confront the problem. He does not want to know the problem. And that should not be forced upon the patient also. May result in the patient behaving differently with different people, right? So this itself, we can see that the patient may sometimes, with close relatives, they may appear to know nothing, like with their wife or with the children. They will just pretend that they do not know about the disease, but they will discuss it with their friend. They may know that that particular disease is there in the patient, and they may be discussing with their friends. The level of psychological distress depends on the patient's ability to cope. So if the patient is really able to accept that that particular disease is there in the patient, then everything is fine. If the patient says no, எனக்கு இந்த நோய் வந்திருக்காது, எனக்கு இதெல்லாம் வராது, if they have this mindset, then it is really very difficult. Factors that are predictive of poor coping, the personal factors. If the patient is anxious, anxiety, உடனே என்ன நடக்குது, right? Anxiety or pessimistic personality. Pessimistic is always having negative thoughts, negative feelings, negative inputs, and poor coping with previous illness. So if they have had earlier an illness, say if they have had a heart attack earlier, and how they coped with the disease, and what were all the problems they experienced, the stress with the disease, and what were all the losses they experienced during the heart attack. So all these will come to the mind of the patient. Most patients cope better than might be expected from the previous history of coping. So the first time he had the heart attack, so he may think that everything was over, everything has come to an end. But now, during his second attack, he'll be able to cope up. He knows what all will happen, what will be the treatment, what will happen post his heart attack. So he'll be able to cope with the treatment. Adverse experience with life-threatening disease in relatives or friends. And some patients, they may know what had happened because of heart attack to somebody else, from his uncle or from his cousin. They may know what had happened. So what are all the treatment? What will happen to the patient? So all these, they can get inputs from the others. And the history of recent personal loss. If they have had a personal loss in their family itself, then that itself can give a better understanding to the patient. And low personal esteem, multiple family problems and obligations. So this is again a factor which indicates poor coping in the patient. If they have plenty of problems in the family or plenty of obligations in the family, they have certain duties which they have to do. So all these can cause poor coping in the patient. And marital problems, if the marriage life itself is problematic, or if the patient has had a history of psychiatric illness, hysteria or depression or something like that, or a personality disorder, an obsessive disorder, something like that, and history of alcohol or substance abuse. Substance abuse is if they have the habit of taking drugs. And the social factors, if they do not have a society support, so if the neighbors, if the relatives do not support the person who is ill, or the resources are not adequate, they may feel isolated. When they belong to a lower socio-economic class, where they don't have money for treatment itself, they don't have money to take the medicines, and the sense of not being valued or understood. So if the family members don't understand their problem, if they feel they're not given priority, importance, when there is no understanding between the family members, cultural, certain cultural traditions usually related to stoicism, showing stoicism is விருப்பு வெறுப்பு இல்லாத ஒரு நிலை, and showing emotions, being undemonstrative, right? In certain cultures, even if there is pain, don't show. There are many family members, in many families, say for example, pain is there, but why should you make a show, or why should you say that your leg is paining or stomach is aching when somebody else is around? So that those things can cause poor coping mechanism. And spiritual, not religious. If the patient is religious to a certain extent, we can divert the patient to religious means. We can ask them to listen to some slokas, or recite certain slokas, and we can divert the patient towards spiritual. If the patient is not religious, they have no belief in God, we have a segment of the society who are like that, then that again becomes a problem. And if they do not have any alternate value system, then the coping mechanism is a little bit difficult in such patients. So the treatment lies treatment of the underlying causative factor, before rushing to prescribe anxiolytics or antidepressant. So first understand what is the problem that leads to this psychological problem, and then don't immediately give the anxiolytics. Anxiolytics are the drugs that are given to suppress anxiety in the patient or depression in the patient. So immediately don't give drugs to the patient. Understand the cause of the problem and try to resolve the problem. Treatment, the general measures are being caring, considerate to the patient. That is what everybody expects, right? We have a small headache, we go and lie down in the bed, and we expect our mother to come take care of us. Thalaiya pidichu vidunga, thailam podunga, and all these things we tell our mom, right? So here, when the patient is really sick, they have to be taken care of. You should be very considerate, and all the irritation, the shouting, all these comes only out of the psychological problem and the pain they experience. So be considerate to such patients. Do not be hurried, and you should have a non-judgmental approach. இப்படி பண்ணா இதுதான் சொல்லுவாங்க அப்படின்னு don't judge a patient. You should first listen, right? So here is where the problem arises. The patient will keep on telling several things. Kai valikkudu, kaal valikkudu, thala valikkudu. They will be keeping on telling several things, right? Be patient. Listen to them. Don't say, அப்படிதான் இருக்கும், right? Listen to them and talk to them. There should be good communication. Listen to what the patient says and then communicate to the patient. Reassurance about continuing care. So that is very important. Even if the patient has a disease and if the patient is going to be debilitated, for example, they may not be able to walk, or they may not be able to use their hands. All these can occur. Say, for example, when they get a stroke, right? Paralysis of the hand or the legs can take place. And therefore, you have to reassure that they will be receiving the care and respect for the person and the individual. Give respect. As you had respected them earlier before the disease, give the same due respect to the person. Allow discussion of fears regarding the future suffering and the life expectancy. Let him discuss. So how long am I going to be alive, or what will happen to in future? Let him discuss. Allow him to discuss. Even patients in denial appreciate such discussions. Control pain and physical symptoms. Most psychological distress becomes less when physical suffering is competently relieved. So in the psychological distress, all these distress will disappear when the pain in the patient when the pain in the patient disappears to a certain extent. Social, address the social issues, encourage social support as a family, as a society, as a community. Provide support for the family and the carers. The patient alone does not require support. Also, the entire family requires support. So the entire family has to be given advice, counseling, and guidance. Maybe by the relatives, by the society where they live, or in the community where they live. They have to be given proper support. But the support that is given for the family members and the caregivers, they are different from the support given for the patient himself. Here they may require only a moral support, a psychological support, advice and guidance. And many carers say they did not receive all the information they felt they needed, right? So they may be given information. The doctors should give certain information. The chemist, the biochemist should give certain information. The nursing assistant should give certain information. A wholesome information should be given to the caregivers also, so that they understand the problems surrounding the disease and they will take care of these problems, so that they will handle the patient better in a better way. Cultural, respect cultural differences. When the patient comes for treatment, different patient belonging to different culture will come there, and they have to be given due respect to the culture they belong to. and also to the type of the diet they consume, vegetarian or non-vegetarian. They like this, they like that. So all these has to be taken care of. The rituals, whatever rituals there are associated with their religion, you have to give space for the rituals also, and also to the customs which they follow. Spiritual, address religious or the spiritual concerns and respect the belief system. You have to, in your treatment modality, you have to address the religious issues, the spiritual concerns of the patient. They may say they may not eat on a particular day, viradam. They may not eat on a particular day. On certain days, they may say they will eat food without sugar or without salt. So all these has to be taken care of, and respect their belief system. So whatever they believe, give due respect to their belief. And other measures include general supportive counseling to the patient as well as the family, support groups, right? So, support group, what is this? So, support group is the a team comprising of individuals with a particular disorder, with a particular disease. So, when there is a group of patients suffering from cancer, they may share their experiences. You can find this, which is taking place casually in the hospitals when they are waiting for the physician's advice, right? During consultation as outpatients, they may be sharing their experiences. So, I had chemotherapy for so many days, I had radiotherapy for so many days, I underwent surgery, and I was able to recover in so many days. So, this hospital is good, that hospital is not good. They are giving such kind of treatment here, they're giving such kind of diet. So all these, when they talk among themselves, so that can give a kind of encouragement, confidence in the patient. So that is called as the support groups. And relaxation therapy, definitely they need it, right? So if a patient has a terminal illness, they must know how to relax. It can be anything. It can be reading books, or it can be reciting slokas, or it can be watering the plants, or going out for a walk. Anything it can be. Right? Relaxation therapy is necessary. Meditation, to a great extent, can relieve all the problems, physical as well as psychological. And distraction. What is distraction? Distraction is just reading a newspaper itself may be a distraction, right? So, reading the newspaper, seeing the events in the newspaper, they may read several news in the newspaper, like there is a flood there, and there was an accident somewhere else, and there was loss somewhere else, right? There may be good things as well as bad things. So, for that period of time when they are reading the newspaper, they forget about themselves, and they focus on some other issue that are taking place, the financial crisis that is occurring, or the rise of the COVID patients that is taking place right now. So these are all certain distractions. They forget about themselves, their pain, and they get involved in something else. So watching television, watching movies, listening to music, reading a newspaper, or reading a book which they like, all these are kind of distractions from their illness. And socialization, talking to people, don't put them alone, don't lock them up in a room, let them socialize, let them talk, right? This itself can give relief to the patient. And psychological therapies in treatment, stress management techniques. So they have to be given counseling, guidance, they should be able to manage their stress, coping skills training. These are all available. And cognitive therapy. Cognitive therapy is understand. They should try to understand the type of disease, and also the treatment modalities. Anxiolytics, or drugs that are given to relieve anxiety, and antidepressants are given to relieve depression in the patient. So this should be kept as a last mode. And supportive psychotherapy is definitely required for these patients. Effective treatment of psychological distress in patients with life threatening illness may greatly improve their quality of life. Time spent listening is never wasted. A truism of palliative care is that Nothing is trivial. Everything the patient says, everything they experience is worthy of our attention. Thank you. Let us meet again.